camera and microphones off, please. Thank you. Good morning to the Council of Governors Representation and Committee. My name is Rebecca Metso. I'm the Acting Lead Governor and I will be chairing the meeting this morning. Thank you for those people attending the meeting and for those people that will be watching the meeting in the future. We do have some absences that have been sent forward, and if anybody has anybody else that they know of who is unable to be with us, if you can ask for their absences, they can then be put in the minutes of this meeting. Moving to item 1.3, declaration of interest. Do we have any governors on the call that have any further declaration of interests? Carol, would you like to make a comment? Carol Hagan?
Yes, good morning. It's Carol Hagan, Public Governor for North Kesteven. I can see that my declaration of interest haven't been added yet. I just wondered why, really. But also in the declaration of interest, it says, against my name, a strange date, 7th of October 2021, and I wasn't a governor then. So I don't know, bit odd.
Yeah. Sam Swindell, would you like to comment on that?
Yeah, of course. Hi, Governor Membership Officer Sam Swindell. Carol, sorry about that. I've had a quick look at it, and yeah, you're absolutely right. I've not had much time to have a look into depth as to what's happened. I think in version control, or maybe because it was added because the action's been completed. But I'll do it straight after the meeting, and I'll send you the version so that you know that that's completed. And again, apologies.
Thank you very much. Karen, did you have a comment to make?
Thanks, Bex. Karen Scott, Trust Secretary. Morning, everybody. I just wanted to highlight, Bex, that as this committee does have non-governor membership, official membership within its terms of reference, we do actually need to add those other non-governor members to the list of declarations of interest, even if it's a nil return. So whilst we have a separate directors register of interest, which is published on the website, I'm going to talk to Sam about creating one specifically for this meeting, which actually incorporates those other trust officers that are members of this committee moving forward. Thanks, Bex.
Thank you very much. Right, so moving on from the declaration of interest to the draft minutes of the Council of Representation Committee meeting on the Monday the 8th of April 2024. Can I have any comments or questions relating to those minutes, please? With that non-C's and Q's, I presume then that you're happy with those minutes. Can I have some Y's and the comments so to confirm your decision that those minutes are approved? And any no's? Thank you very much. Moving on to the schedule of actions from those minutes. Sam, are you able to help out with this, please?
Yes, of course. Yeah, thank you. So we've got two scheduled of action points on here that are outstanding. The first one, the Lincolnshire-wide autism strategy, we'd planned possibly to have representation for this meeting, but due to sickness absence, it's been bumped to the next meeting. And there has been a few changes in the department in terms of who's leading off on it. So we are planning to do that for the next meeting. The Better Together membership plan as well item, which was from Anna. So at the last meeting, there was a suggestion that in order to better engage our trust membership, we could potentially use click text, which is texting members as well as emailing. And what I did agree to do was to go away and ask the question to the membership database as to whether there would be an add-on for contract, which I can confirm there is, and I am in negotiation in terms of how much that would be. But I have actually found out some information as well. So I've done some filters on the membership database about how many numbers and what percentage we're looking at, just to feed that back to the committee. So 28% of valid mobile numbers of the total membership of the database could be utilised for this function if we was to go ahead. And in terms of out of that 28%, if we were to do emails, we would be cutting it down to 901 members to send out to text. I think because I'm in the middle of negotiating this with the database company, I think what would be useful is, once I've gathered all the information, to write a report for this committee at the next one, just to give a number of recommendations in terms of whether we go ahead. Also bearing in mind that you only have 160 characters to communicate as well with a click text, and how successful that might be at engaging. But I did think it would be important on the schedule just to update and give a bit of context behind what I've gone away and done since the last meeting. Bex, if that's okay.
Thank you. Is there any questions or comments for Sam with regard to the schedule actions? I take that as a no. Thank you very much. Moving on to item 2. Item 2.1 is One Governor Experience, and this was to be Olivia Taylor, one of our newer governors, but unfortunately she's been unable to be with us today. So I'm going to tell you my story as to how I became a governor. In the dark and dim past, I used to be a trustee of a dementia charity in Sleaford, and there was an event that was being held in Grantham, and that event, it was a case of it said dementia, so I thought, right, I've got an interest in dementia, I'm going. So I went to it, and they mentioned about becoming a governor at this event, and I thought, yeah, I could do that. So I put a nomination in, and that nomination went forward, and that was back in 2019. And unfortunately, I didn't succeed at that time. Somebody else was voted in, but obviously I got a few votes, and that person in the spring of the following year decided that they were moving house and they were going to be unable to continue as a governor. So I had a phone call from the governor and membership officer saying, would that be something I'd be interested in taking up? And I said yes. And so in August 2020, which we all remember for very unhappy reasons, I became a governor. The unhappy reasons being that we were right in the middle of COVID, and all our meetings were being held like this. So it was very different times. Since then, I've got to meet so many wonderful people in the trust, not just my fellow governors, past and present, but lots of members of staff and service users, and found it really interesting interviewing new staff to sort of get involved with the trust, to find out what the trust was all about. And then the opportunity for Deputy Lead Governor came up, and I thought I could have a go at that. So I got voted in for the first time, and then the second time, because you only do 18 months as a lead or deputy lead governor, I didn't get in, but unfortunately a few months after the other person did, they actually left being a governor, so they couldn't remain as deputy lead governor, so I became deputy lead governor. And then in recent times, with Debbie stepping down as our lead governor, but remaining as a governor for the foreseeable until our elections that we're currently running are over and we know whether she's managed to get back in. We have me as your acting lead governor, and it's a great honour to actually be doing this. So thank you for being there. Thank you for everything that you do. And as obviously yesterday was thank you day, I want to say thank you to the governors, the staff, and I also want to say thank you to everybody who's has anything to do with the trust, be you volunteering for the trust in the way of a governor or a volunteer or members of staff. So that would be me. So keeping it fairly short and sweet. Does anybody have any questions of me or comments? Laura putting in the chat she remembers meeting me at the Grantham meeting. Chris Davison, you have a question. I think you need your microphone on.
Thank you. I was I was being muted. I guess you've had some experience now. What would you say to a member of the public who is considering whether or not to be a governor? What would you say to them? Thank you.
I would say it depends on what constituency that you're heading for. I would also say that it's not something that you take up lightly, but it is something that you can really make a difference to people's lives, people that need that difference making, and you can bring to it lots of different experiences. So my experiences and my specialist interests are really dementia and suicide intervention. But I did volunteer as a special constable for 10 years with Lincolnshire Police. So I've got lots of different experiences, and I think those experiences bring to the NHS something different to people that have worked within the NHS. You may be somebody that's worked within the NHS that has become a governor, but it's certainly you know, something very different. Does that answer what you were asking for? Oh, thank you. That's nice. Yeah, I've got a nice little message from Chris to say thank you, Bex. Great answer. So thank you. Moving on then to item 2.2 on your agenda, the Governor and Membership Delivery Plans. Sam Swindell, please.
Hi there, thanks for that, Bex. Yeah, so this is the Governor and Membership Delivery Plan, and this is what all of our plans are that are coming off the strategy for 2022 to 2027 for those of you who aren't au fait with this report. The advice to the committee is that the action on to look at the actions on the Governor and Membership Delivery Plan and to consider any progress and decide whether any actions are required. We've had a bit of a change in format with this. Me and the Deputy Trust Secretary have worked together to look at how we can make it a bit more quick to visualise and see what actions are still in progress and then which ones need to be completed. And then when there's been no action to report, because we just felt that there was a little bit of repetition going through the document. So the document's no longer in number order, it's in order of in progress completed in that order. So some of the numbers are not as in order of priority objectives as they was, and we would appreciate some feedback on that as well, if the governors would like to make any comments. But there are a few items that I would like to draw out. We are trying to get governors more involved in this plan, to try and deliver off on some of the objectives. We have updated, and there is ongoing work. There is a lot of work in this that we currently do, but just to sort of draw out for governors, and I'm keen to know what governors think about this document, and you know how they could potentially feed in more ideas to it and the work that's involved. But if I just draw a few of the items to attention, because there is 23 pages to this document, so I don't want to ask questions specifically about each one. But in terms of the SO1D, for example, where we're trying to engage with less well represented groups, there are opportunities for governors to come along, so that we come along to our Pride events, so that we can engage with the protective characteristics specifically of sexuality, for example, and as yet I've not had any governors come back to me about attending the Governor Membership Services stand with me to enable us to connect with the community. So that was one thing that I wanted to draw out, that the dates are on the Governor's Fortnightly for those two events, and that we've got the stand booked in, so just need some governors to come forward to help us with that a little bit more. And any ideas and innovations as well that are welcome from governors in terms of the protective characteristics. So as your Governor Membership Officer, I can say to you that we need more males on our membership, because we are more weighted towards females. We also need more 16 to 29-year-old members as well. So it's thinking about in your everyday life and your governor activities how you can help to improve us do that moving forward and feeding that back into this plan. I'm going to pause there before I move on to any other items. So specifically about the SO1D, has anybody got anything that they would like to add to what I've just said from the meeting?
Well, I would like to add something, and that is anybody considering volunteering to go to Pride, do it, experience it. It's the most fun that you will have. You were there for the trust, but you will have a lot of fun. I've also got another hat within girl guiding in the county, and I took girl guiding to the Lincoln Pride for the first time in 2018. And yes, the girls had fun, we had fun, and it was a really good event to sort of get talking to people.
Yeah, absolutely. It's a really good day. There's lots of trust representation from different departments, including the recruitment team. It's a way of you contacting, meeting up with the members of the public. It brings ideas and issues, which is another paper that I delivered today, to come forward. So when you're talking on the stand with people, they will talk to you about, what concerns or ideas they've got for the trust, and it brings in more of that. So there's a lot of connections to the papers that I'm delivering today that would meet that if governors were to be able to attend. Yeah.
Carol
So
has a question. Would you like to ask your question, Carol?
Yes, hello, Sam. In recruiting membership of the males and the age group you suggest, I just wondered if there are copies of the Better Together magazine and Shine in the cafe areas or the waiting rooms in the new builds that are being built, for example, the Peter Hodgkinson Centre. or do people who've had support, are they encouraged to join the LPFT? And also, I was going to say this later, and I might mention it now, or shall I say it later, Sam? I think the membership form at the back of the Better Together magazine could be a lot more user-friendly.
Okay, so there's 3 questions there, Carol. The last one probably for the Better Together item at the end, but I'm sure Jo Walker's on the call, Head of Communications. I'm sure she'll have picked that up to address that one later. But in terms of, you know, sort of having Better Togethers go out to trust services, yes, absolutely. They are delivered to trust sites. We have a routine that we do when we have Better Together get published and it hits the doors of the members, that it actually goes out from a spreadsheet collation. And it's not just internal that goes out, there's also a number of key stakeholder groups as well that it goes out to. I think on the second question that you've got, I think there's some scope for some discussion there in terms of how we might open that up to patients that are receiving the services. If I've understood that correctly, Carol, that what you're saying is you're trying to connect to the patients and the carers within the services, and there might be some scope to look at I do believe that the involvement team are including the membership leaflet within the discharge packs for services, but you know, sort of looking at the ideas around that. I
mean, I'm thinking straight away of some of the engagement events I've been to. I think there's been missed opportunities there. I think at all engagement events where you're asking members of the public to come along, for instance, there's one this week about the older people service in North Highcombe. I think there should be membership forms or the Better Together magazines there, you know, for people to take if they want, because that's another group of people that are coming along to an event, you know, and could be told, you know, this is what LPFT does. We try to engage with the public, and we would encourage you to join because. And so, you know, I think there are some missed opportunities.
I mean, thank you for that, Carol. I do have to say, though, that we do that. So we've got Linda O'Hara on the call, for instance, who's the manager involvement. And are you referring to the 10th of July meeting for the cooking conversation?
No, meetings I've been to, you know, engagement events I've been to.
Yeah. So you know, depending on who's out and about, whether it be the recruitment team or the engagement team, they do have a number of leaflets and magazines that they do promote for us when they're out there. But having said that, you know, there's always improvements to be made, and it's kind of looking at all of those connections, which is what I think you're saying, to make sure that it's not just our team going out, but it's also connecting it through other teams.
Yeah, I think that if you're going along to a public event that's been put on by LPFT, there should be automatically some magazines or membership forms given out to people. Are you a member of the LPFT? You know, we would encourage you to be one. You know, here's a form to fill in while you're here. I think there are some missed opportunities.
I think you're right, Carol. If I'm honest, yeah, I think we need to sort of tighten that up.
Okay, thank you very much. Thank you very much for that, ladies. Was there anything else that you needed to follow on from that, Sam?
There wasn't specifically. I mean, there are some ideas on here in terms of, you know, identifying opportunities through induction, in terms of working with the leadership team as well, to try and get an understanding from people what Foundation Trust is, and you know, thinking along the lines of probably a possible relaunch of Foundation Trust through our comms, and you know, having possibly a working group with governors to be able to produce some of that work, to look at how, I think, as much as I've got lots of support from our senior leadership team, they help out, I think there's still a lot of people in the trust that don't understand Foundation Trust, and that we can relaunch it, if you like, and make it more salient so that it's not just sat in the backdrop, it's actually sat in the forefront, if that makes sense. So a lot of what's coming out of the plan, what I wanted to mention, I said I didn't want to mention all the items because there is, you know, comprehensive updates there, but I think those are the two main things that I want to bring out of the plan today, and quite happy for any of my colleagues to make any comments that they want to in relation to that.
Okay, thank you. I just wanted to point out that if people could introduce themselves and explain their connection within the trust. We've just missed a couple, I think. I think it's a case probably that we've had one or two people speak a couple of times and not had what they needed to say. And I'm not missing you out, Di. You have a comment and a question.
I do, thanks, Bex. Di Bailey, Deputy Chair of the Trust. So just to go back to the point about pride, and I think it kind of links with Carol's point about some missed opportunities, really. So I just wonder whether we could be a bit more joined up between maybe some of the non-exec activities and governor activities. So, for example, I think it's Skegness Pride on the 7th of September, which I'm planning to attend as a resident of Skegness. And I would be delighted to be joined by any of our governor members if they were, if they wanted to come along to that. And I think sometimes if you know that somebody else is going to actually be there, it can make it easier sometimes to turn up to some of these things rather than just going along thinking, I may be the only one. So, Sam, I wonder whether there is something we could do. Because I'm conscious that as non-execs we get involved in a number of things, and we say that we will be, we'll be at certain things, whether we could somehow join that up a bit more so that governors know when we're going to be there, and the other way round. Sometimes, I'm maybe more minded to go to something where I feel that there's going to be targeted governor activity, and where I think, well, I'm just going to be the only representative. So, and I think that way, that strengthens the profile of the organisation in terms of how we might be perceived by the members of the public that we're trying to recruit. So that was my comment, Bex. I had a question, but it was about something different, if that's okay. It's in relation to the plan, but it's not about the sort of the widening membership and diversification issue. So I guess I was just a little surprised to see that in terms of the plan, strategic outcome 6, to hold the board to account via non-exec directors for the performance of the trust, and we've got no actions in progress there, and I guess I was just a little surprised by that, because I think it is important for us as non-execs to feel that we are being held to account by the Council of Governors. There's a lot going on at the minute in terms of implementation of the new strategy. We've got the new performance committee. So I think really it's just it's just flagging that there are things happening, and whether or not there are any actions, any areas where you feel that we could perhaps be I guess, where you could be holding us to account, and I think, some of the conversations that I've engaged in with governors, where I've been to governor events or where I've done on Teams events, I think those have been really useful in terms of governors being able to ask questions of us non-execs, sometimes in a different forum to the ones that we, that are perhaps a bit more intimidating. So, maybe there is an ongoing action, which is about active engagement with non-execs, so that you do have those opportunities to ask us the things that you want to ask us in ways that are most appropriate.
Yeah, can I come in there, Bex? Is that okay?
Yeah, please do.
Yeah. everything you've said, Di, is music to my ears. I really would like, it's not just about perceptions. As much as you did say, it's almost like governors being seen side by side with NEDs, and that those dots are being joined up. And as much as the plan, does say that there's lots of things, and it's just kind of making that practical link, that operational link, and making sure that the plan is updated in that respect, and also just getting a bit more out of that relationship, I think, because you've actually got your working relationship of getting to know through your Q&A sessions, which are working really well. You've got your performance report that goes to council, which is really, really good. It's getting more and more comprehensive as the time goes on, and that link is working really well. But I guess in terms of like the flow of governors representing members and then holding the directors to account through the NEDs, it's kind of that moving that flow through, and making it more transparent as to where it applies, and any ideas, and actually, that we're not 100%, as you've said, Di, we're not 100% potentially efficient at it, and just making sure that we've got that. We're constantly improving and adding more ideas as and when. So it was music to my ears. Just thought I'd let you know.
Thanks, Sam. And I think just to add, certainly in terms of the the work around health inequalities and the healthy populations that is front and centre in the trust strategy, this is where I think our governors are a real asset to us. And again, I just wonder whether, in terms of some of those joining up links, thinking about the constituents that we engage with through our recovery college, and whether there are links that we can exploit more that way. So, very, very, recognise that we're doing a lot. I guess it's just about how we just be a bit more impactful through some of the things that we are doing.
Yeah, and maybe it might be a case that when we do more working groups that, the NEDs are actually invited to those.
Yeah, absolutely. I think that would be a good idea, particularly again for some of the newer NEDs. It's a good way to understand how we operate and the constituencies in which we operate, I think.
Absolutely. Thank you, Di.
Thank you. Jo Walker, please.
Hi, I'm Jo Walker, Head of Communications and Participation. I'm just going to go back to the questions and comments that Carol raised, if that's okay, specifically around the membership form in Better Together, because I think it's actually probably better to include it here rather than with the paper a bit later on. So that it does mimic our current membership form in Better Together. So I think it's probably a wider conversation, Sam, about actually if we can plain English the membership form in general, because obviously the one that's in Better Together mimics. So I think it's maybe a bit of a working group or task and finish group just to have a look at, do we need all the questions that are in there? Is there any way of plain Englishing or easy reading, particularly for our LD, learning disability and autism audiences potentially? And then we can kind of then replicate that in Better Together going forward. So I think it's probably a wider conversation about the membership form in general. And just to also say, I obviously look after the engagement and participation team as well, and Linda's on the call, and we've been having a for conversation about, we will make sure we've got Better Together and the membership forms with us at all of our events going forward. And I'll also pick up through the other people in our organisation that do engagement as well, like our Every Voice Guardian and sort of the learning disabilities and children, young people engagement people, just to make sure that they are regularly sharing that as well. So I'll pick that up as an action.
Thank you. I recognise that Karen has a comment to make, but Carol, is that a comment that you've just asked to in relation to what Jo's just had to say?
Yes, thank you. Carol Hagan, Public Governor for North Kesteven. Yes, Jo, that's very good to hear. I think looking at the membership form, it just needs to be more user friendly, and I think it needs to take two sides of the A4 so that the font could be bigger, the questions more spread out. But I think it needs to be, as somebody's already mentioned in this meeting, why? Because you're a trust, you have to have membership. And two, what would be the benefits of being a member, just very, you know, a sentence each at the top, and then the questions, and then on the back maybe the bits you have to fill in about ethnicity, etc. But just making that form more user friendly. But that's really good to hear that you're going to have a working party on it. Great.
Thank you. Perhaps Carol's volunteering to be involved in that. Moving back to Karen, thank you for being patient with me, Karen, because I felt that perhaps Carol did have a comment to make with regards to what Joe had to say. So thank you for being patient with me.
That's all, Bex, and I'm sorry that we seem to be jumping backwards and forwards a bit, but Karen Scott, Trust Secretary, I just wanted to go back to the conversation that took place between Di and Sam with regards to the governors holding the board to account via the non-exec directors, and I think Di was very magnanimous in suggesting ways in which the non-exec directors can engage with the governors, and highlighting the potential for that to happen further, and I absolutely support that. But I think in terms of the governor and membership plan, I think it's really important that, talking about the examples that Sam helpfully used that we already utilise, I think it's really important that we check in on this on a regular basis to ensure that actually governors are utilising and properly engaging in the activities that actually are there and the vehicles through which they do have the opportunity to hold the NEDs to account. So, for example, in Council of Governor meetings through the performance assurance report, yes, we've thought of all sorts of other things, and there are other more informal engagement sessions that go on. But I think it's important and incumbent on us, given that this is the governor membership plan, that actually we check in on the level of that engagement, because we can come up with any number of ways in which that might be facilitated, but it's a question of to what degree it is. And it's, you know, we can put quantitative measures to that, but that's not always a helpful measure, because sometimes it's about qualitative information as well. But I just wanted to point out that this is also a responsibility of the governors in actually fully engaging in all of those vehicles. Thanks, Bex. Oh, you're on mute, Bex, sorry.
Thank you for reminding me. I think we've talked that one through quite extensively, so thank you for those that contributed. And moving on to the governor elections and vacancy update. Sam.
Thanks, Bex. So I've put the governor vacancy report and election plan together. It came to the last meeting, and what I've done is I'm showing in grey what we've gone through, where we're at in terms of the elections, and it is for the governors to ask anything and to receive the report. However, I'm happy to just go through a few bits in terms of that. We've at the beginning part of the report, it sets out which governor seats were up for election, and just to point out that we in time were able to add another seat that was due to a resignation of one of the governors, and that our deadline for elections is today, and that to date we have majoritively covered the seats in terms of interest with current governors. We've had some interest for other seats, but it has been less than it would be usually. And I've kind of sat back and thought, you know, what are the reasons for that in terms of how different it's been this time. And I think from my point of view, we came to the committee last time to agree the plan. We you know, any suggestions from the governors were put in at that point. We followed the plan to the letter. We've even added extra bits in terms of you know, utilising trying to utilise social media and Facebook posts, but unfortunately, and I don't know how we managed to do this, because it couldn't have been avoided, but the election just took place at the time that the main election took place, so we were under several restrictions with PERDA. We had plans to work with Trust Services to do some roadshows to get out into the public, which we weren't able to do. I remember having a conversation with Joe in head of comms and saying, you know, this is where we're at and the suggestions, and there's some suggestions to go out into Springfield, supermarkets and co-ops, which I looked into, and there was a block with it as well. I did manage to get into libraries with the governors, so Carol's on the call. Libraries and the Riverside Hub in Sleaford. So Carol came with me to the Riverside to help recruit during that time, and then Emma Slack was with me in Boston to try and talk to the public in Boston last week. So we've tried to get out there and use our governor and membership services stand where we can within those restrictions, but unfortunately I think it's had an impact on the elections this time, despite the efforts. Do want to give a big thank you to Lucy Williams in comms, because she's been on it with all the comms. You know, we've done everything right, we've done everything to the letter, and more. So a big thank you to her for working with me on that, and you know, just continuing the efforts along the time frame that we've got. So I don't know whether anybody's got any questions. We're at the nomination deadline today. So all of those candidates are going to be going into verification checks before, you know, the statement of nominated candidates can be released. And then we go into the voting stage. We have got one seat contested, which is our Public Southcare Stephen. And so we will be going to election for that one, but we won't be going to election for any of the others. So the seats will fill uncontested that have had a one-person interest. So unless you've got any questions to ask from the governors, and I'm happy to answer anything I can, yeah, feel free to come to me and ask them.
It was just the one question from me with regard to vacancy report. We do have a stakeholder governor, volunteer governor for the trust for our volunteers. I believe that should be shown visible at some point, because the role has been vacant for a little while. It means that there may be governors that do not know that that role exists. So, and they may have friends that might be volunteering for the trust that they can mention it to, and that could be a way of filling it. I know there's been extensive work within the volunteer department to try and find somebody. But it would be nice to actually have that role fulfilled. So it's just a comment.
Yeah, no, thanks, Bex. And you're right, it isn't included on here. I guess the reason why I've not included it on here is because it's the governor vacancy report for the elections, and the stakeholder seats are appointed. But I think there's a point to be made about, you know, making that a bit more obvious, and maybe it could be under a separate header within the report. I'll go away and have a think about how we can do that so that we can make it better known to the governors and people out there. It does go on to the governors fortnightly, but again, I'll look at the communications in terms of whether I can improve and make that, you know, stand out a bit more, if that's okay.
Thank you. Di Bailey, you've got a question?
Thanks, Bex. Di Bailey, Deputy Chair. Yeah, just I probably should know this, so apologies. But just in terms of the elections, if after going through the process, Sam, that you've so helpfully described, we don't have a governor occupying a seat in an area, what's the process for filling that? Do they have to wait till we go through a re-election again, or if somebody decides sort of part way through the year that, you know, that they become aware of it and they would want to take that up, can we do it as an ongoing thing, or does it have to be within a given period, I suppose, is what I'm asking.
Yeah, I mean, it is within a given period, so we do have to go out to re-election because we have to be seen as democratic. But equally, we would, if interest came in, we would keep in touch with that person and keep them interested until that election came up again. We can run an election at any time you want.
Right.
Historically, we've kept to the one a year due to just, you know, costs and election fatigue and things like that. But we can always run by-elections in between times if we see that, if we've got the interest there, I would say is probably a good reason. Yeah.
Okay.
Yeah.
All right. Okay. Thanks for that, Sam. That's really helpful.
Yeah.
Thank you for that, and thank you, Sam, for your extensive work on that. Moving forward to item 3 on the agenda, involvement activities. I'd like to invite Linda O'Hare for the participation activity update.
Thank you, Bex. Good morning, everybody. I'm Linda O'Hara, the participation lead for the Trust. So just to give you some highlights on my report. Firstly, just to mention, you may already be aware of this, that the Building Together focus group were successful for a second consecutive year in the Designing Mental Health Awards for the Service User Engagement Award. And also that we were competing against entries far and wide, including specialist mental health services in Christchurch, New Zealand. And so we had some very strong competition. And of course, important to mention that the LPFT clinical project won Clinical Team of the Year. So there remains a very strong partnership between all involved in the programme. And we're proposing a site visit for Building Together focus group members in August and September to promote a Golden Trowel event as the construction team start to build up on Norton Lee's site. And then at the same time, we'll be burying a time capsule, which I believe Ward 12 and patients are currently working on. So older people and frailty services. Bex, you mentioned earlier that back in 2019 you joined us at an event held in Grantham. So it's lovely actually that we're continuing to report involvement for older people and frailty services across the years. So we're nearing completion of a phase 2 of engagement that was held between the 14th of May and the 16th of July. So we've still got a few ongoing events. So we've had public events in Grantham, Gainsborough, and we did one online as well. And then we've got one on the 10th of July this week at North Hykeham Town Council between 1:30 and 4 p.m. So obviously you're welcome to drop in and join us there. And we've had a number of community group visits, and we've still got a couple on the 11th of July, one in Grantham and one at Market Deeping, and then we've got one on the 16th of July over at Spalding. And I know that the older people and frailty service staff members have been working really hard to ensure that we capture a range of views about some of the changes and developments. And also just to mention that we've restarted the older people and frailty stakeholder group that currently has 11 organisations represented, and it's just an excellent opportunity for those organisations to network, share ideas and hear about our service development. So the next thing on my list is just to mention that we're in the process of establishing a council of patient and carer groups to ensure that we have a representation across a wide range of people that we support and their families. This is about bringing all those voices together to report into the Quality Committee and strengthen the partnership of people with lived experience to ensure that they are heard right through to board level in the Trust. So we've been very busy behind the scenes organising that as a team, and we've identified a number of patient carer groups from across the trust, and we've met together with staff and people with lived experience since April this year to start working on the terms of reference. We're planning to launch the council in September, where we're hoping to finalise the terms of reference, decide on a name for the council, and also include a schedule of meetings across the year. So watch this space on that one, and I hope at some point you might be able to get involved as well. So staff recruitment, we continue to get regular requests for support with service user and carer involvement in staff recruitment, and since April as a team we've supported 12 interviews for a wide range of roles, including learning disability and autism services, our comms team, and some community mental health team positions as well. And we've also just received a recent request to deliver a presentation to the It's All About People Personalisation Board to share some good practice, because they've heard actually that we are doing some really good work around including that voice within staff recruitment. And then I guess coming towards an end of this presentation, following our previous COG rep committee, we've liaised with Sam, and we're going to be delivering a presentation about the work of the participation team on the 15th of July from 10 o'clock to 11. So I hope you can join us at that, and we look forward to seeing governors on that date. And just following on some of the conversations about magazines and leaflets, so we definitely do our best to take out leaflets and magazines to some of those engagement events that we're involved in, and I think there's lots of opportunities throughout the trust to promote membership. So Di mentioned Recovery College students, but there's also lots of lived experience roles, so maybe having a task and finish group to look at simplifying the form might also be a good opportunity to have a look at where else we can promote and share some of that information as well. So finally, if there's any questions you have for me, please let me know. Thank you very much.
Thank you, Linda. I'm just checking for questions. Emma, would you like to ask your question of Linda, please?
Hi, morning everyone. I'm Public Governor for East Lindsey. Morning, Linda.
Morning.
Yeah, I was just wanted to know a bit more about the Right Care, Right Person lived experience focus group, and as to how long that's been going and when they meet and all that type of thing, and also this council of patient and carer groups. I wondered on those as well, if you could help me on that, please.
Yeah, so the Right Care, Right Person group has been meeting on a monthly basis. It hasn't been up and running very long, but it is in a response to Lincolnshire Police wanting to take a different approach to meet the needs of the local population. So previously, where they were making some welfare calls, that's something that they're not going to be attending anymore. So it's really about how we as a trust work in partnership with others to perhaps look at how we respond in the future. I'm not an expert in this, so I can't say much more, but it is a national approach that the police are taking. Some police forces are further ahead than others. So what we're doing with the Right Care, Right Person focus group is just that we are making sure that some voices are heard, and that those representatives also join the tactical group, which is made up of lots of different agencies interested in working together to look at some new approaches, if you like, and how we react differently as the police withdraw some of their responses that we would expect previously.
So does that mean that the police are no longer going to do a welfare check if you request that of them?
I believe so. I believe that they're only going to emergency responses.
Wow.
But again, I'm not an expert in this, so perhaps if there's nobody on the call, or whether we get somebody to come in, talk to the governors further on.
Well, I find that a bit of a concern, really, because in general, it is in the general public, you would, you know, if you can't get hold of somebody, or all sorts, you know, and there's a lot of worrying circumstances, and believe me, I do know this personally.
Oh, sorry to interrupt. I've just realised we've got Chris Davidson on the meeting, so I'm sure Chris will be able to give you much more information than I can at this stage.
If I just finish what I was saying,
Mm-hmm.
and it was, like I say, from a personal aspect as well. You know, if you want to have a welfare check, you know, you ring the police and ask them to do that. So if that's not going to be in play, how do the general public know who to get hold of to do that instead? That would be my question to
Chris, do you want to come in on this?
I will, yeah, just so, because I didn't introduce myself earlier. So I'm Chris Davidson. I'm an Assistant Chief Constable at Lincolnshire Police, and also one of the governors. I also, I'm one of the leads for Lincolnshire Police's approach to right care, right person. So I've popped in the chat there a link that will take you to the College of Policing's toolkit. So it basically explains what it's about and what it means. And I can really understand your kind of gut reaction to the explanation. It's not quite right in terms of what right care, right person is. So there have been a variety of different approaches across the country about how right care, right person is implemented. And I'll start by saying what it means is trying to establish the right organisation to provide care or services, rather than a default position, which is after hours, the police will do everything. And the reason we've had to come to that position, and I've been our mental health lead for 12 years, so I'm really passionate about this area of work. But the reason why nationally police have come to that position is that we find it very difficult to get to our kind of what you might think of our prime kind of calls, so domestic abuse calls and calls around serious crime, because quite a lot of time is being taken up with things that were probably outside of what the police were originally designed to do. Now, the different approaches, and have been some very different approaches. So let's take the Metropolitan Police. The Metropolitan Police said, I think they gave about 3 months notice to say, we're going on a big bang and we will no longer respond to any of these calls. Rest of the system over to you. That is definitely not what I wanted for Lincolnshire. So we've had quite a long lead in working with partners to try and establish where are the gaps, what are we being called for, and who are the right people to make sure that people's needs are being met. Because often, actually, the police service might not be the most appropriate people to attend, and there are all sorts of different examples I could give you that would probably make people's eyebrows raise about why the police were called in the first place. The long, the short and the tall of it is that for us, we will continue to field calls from members of the public, absolutely right, and we'll assess each to make sure whether or not we are the best organisation to be able to support people. But in the event that we're not the right people, what we'll do is have worked out who the best organisation to cope might be, and to help the caller get the help that they need, because our overarching principle in Lincolnshire is to make sure that nobody's left in need. Just because the police aren't the right people, it doesn't mean there isn't somebody else in the system who isn't. So I hope that kind of explains the general principles. This is not about the police not answering calls or saying that, you know, who might you call? That's a really good point, Emma. I've seen it in the chat about public need to know how to contact instead. So a good example is the 111 number for non-crisis mental health concerns. Yeah, actually, you know, if you're not in what the Mental Health Act describes as a mental health crisis, the police might not be the right people for you to speak to. None of my colleagues, myself included, are clinically trained. We all do the best that we can with our kind of experience, but there are colleagues within the health sector who are much better placed for us. But the important thing is that even if we receive the call from a member of the public, we'll make sure that they get the help that they need. We'll transfer the monitors to another organisation rather than just saying it's not the police, over to you. I hope that makes sense.
Yeah, it does. I'm just concerned that the public wouldn't understand that there needs to be more work on making sure that the public will understand where they need to go to if they have that issue, because they're already in, if they've got a family member in that crisis or whatever, you know, so you need to know that you've got that information to hand, that it's like, oh, okay, I'll ring 111 then if I need somebody to go and check on them, or that, you know what I mean? You need to know that that information is there.
Absolutely right. It's an ongoing piece of work, Emma, because, you know, for a very long period of time, you know, people have been calling the police because we're the service that are available 24/7, and I completely understand that. You know, part of, like I said, part of the thing we have to do is the ongoing comms, and we work really closely with partners across the whole system. But it takes time to get that out about, you know, what are we there for, and to kind of break that down. But in the meantime, the important thing is, if you call us with a concern, it's not necessarily for you to have to figure out how to navigate the system. You know, we'll still take the call and we'll try and figure out the best way for you, you know, the best way for you to get the help that you need, because, you know, in many cases, it won't be a uniformed police officer turning up in a car that's going to give you what you actually need. In those cases where, you know, there are inherent risks, or we're really concerned about somebody's life, that will always, I think, fall to the police, and we'll respond, particularly in terms of crisis, in the way that we already have. You know, we've got a really well-defined role within the Mental Health Act 83 around crisis response. But for things that fall of sub-crisis, we'll take each case on its own merits and make sure that the most appropriate help is reached people. So that's, you know, the right care, right person piece for me is all about making sure that the person who needs the help gets the most appropriate help, rather than it being a kind of police position of, we just don't do that anymore. That's not what I wanted for Lincolnshire, and that's why we've taken a lot longer, I think, than some of our colleagues in other areas who have taken a different approach. I won't say it's the wrong approach, but I've taken a different approach.
Yeah, thanks for that. I mean, I just know from a personal level how that feels as the family behind that person. You know, if you want my help with anything on helping with that, because I can bring my experience to that, you know, if that's required. Because I feel it's really important, because families as well need to feel that they're supported while they're going through the crisis with their person as well, if that makes sense. But yeah, and then I think my other question was about the counsellor, patient and carer group, Linda.
Yeah, thank you. And just to add, Emma, more than happy to send you the link, the dates for the next Right Care, Right Person focus group that you can get involved in. Thank you.
Before you ask your next question, Emma, I just wanted to point out that there's a lot of information been put in the chat, and to thank Chris Davison for putting that information in there. And even after the meeting, if you go into the chat for this meeting, you will be able to access that link. So if you want to ask your next question, I've got another couple of people with questions, and we're looking at time. So if then you can ask your next question.
Okay, yeah, it was just about the Council of Patient and Carer Groups, just a bit more info about that. But I mean, you can always email me instead if that helps.
You can, yeah, can do, Emma.
Yeah, do that.
Yeah, I mean,
Okay.
it is all very new. We only started having some conversations back in April, and it's really it's recognising that we've got lots of different focus type groups across the trust, and it was really finding a way of how we can gather some of those voices together, just to strengthen those voices at the quality committee and up through to board level. So as I say, we're in the very early stages, but yeah, certainly I can drop you an email, Emma, if that's okay.
Yeah, thanks, Linda. Thanks.
Thank you. Dan Fleshbourne has a question for you.
Good morning, Dan Fleshbourne, Adult Community Governor. So yeah, just a quick question around the council and patient carer group. So we already have a really well established and attended carers council, and I wondered how this would sit with that carers council group that's already existing.
So morning, Dan. Yeah, this is not to take away from what the groups are doing, and that includes the Carers Council. So all of the groups, the Carers Council will continue, you know, as they have been doing. This is more about how do we share best practice, what's happening, any concerns that people have got, and joining those up really to then report into the quality committee. So it's not to take away from what all the groups are doing. That was never the reason behind it. It was more about strengthening those voices.
Yeah, thank you for that reassurance.
Thank you.
Thank you, Dan, and thank you, Linda, for your time in the meeting this morning and your very well received answers to your questions.
Thank you.
Thank you. Moving on to item 4 on the agenda, government involvement opportunities in service development. Item 4.1, I'd like to ask Sam Swindell the forward plan and ideas for future meetings.
Thanks, Bex. So this is
provided. Sorry, Sam, can I stop you? My mistake. I did say I would go back to Rob. He did have a question about elections for you. I just wanted Linda to get her questions all together. Rob.
Hello. Yes, I was just wondering, with the elections that we run, just what the cost of them was per each election. I'm aware, for example, on a bigger scale, if we were to have a referendum on something in the whole county of Lincolnshire, that would cost £1 million. So obviously it's not going to be dramatic like that for the trust, but I was just wondering, just as a sort of day-to-day rough figure, how much it costs to run an election. That's all.
Yeah, thanks, Rob. I appreciate your kind of understanding from your background. You know, as you say, the elections are they're not free, basically, and you know, there is always a cost consideration when we run an election. It is hard to say, to give you a figure, because it does depend on the publications and the extra publications that we may or may not do. It's also down to a certain level of negotiation on my part as well between providers. So once a year I'll negotiate another cost, you know, and often a lot of my strategy has been on loyalty, and so, you know, sort of a discount based on that and how well I can negotiate a cost overall for things comes into it. So there isn't a ballpark figure that I can give you, and it does depend on a number of factors, but there is a cost difference between whether a seat is contested or not. So uncontested seats are less of a cost than contested seats, obviously because of all the publication that goes around the voting stage and going out to election. But I'm sure in that I'm not really telling you anything you don't already know, Rob. So, you know, I'm happy to have separate conversations with you, but for the purposes of the meetings moving on, I hope that's sufficient.
Yeah, I mean, it's just a passing thought, that's all. That's okay. Thanks a lot. Cheers.
All right, thanks.
Thank you, Rob, for that. And I'm sorry, Sam, for interrupting you. Item 4.1, please.
Okay, so the forward plan of developments, this is to provide governors with an overview of future meetings, events and opportunities in the next quarter, and the governors are asked to receive the report. It is a list of different types of formal meetings, informal meetings, events and briefings. We've got the Board of Directors meetings noted there, trust events that are internal and external. So I guess in terms of its positioning as a report, you've got the governor and membership strategy, you've then got the plan that goes into that, and then you've got all of the activities in this report coming into the plan. So that's why you'll see that the Pride conference, which I mentioned earlier, is on here as an activity for governors to get involved in, and there is a number of things on here that we are putting into place as activities that feed into our plan for the governor and membership plan strategy. So unless I've got any questions from the committee, it is pretty straightforward that this is a list of opportunities. There's nothing on here that isn't on the Governor's Fortnightly that doesn't get updated. And, you know, we're showing how this could feed into the plan in terms of activities. So if I've got any questions, I'd be happy to take those from this report.
Any comments or questions? Then I'll take that as nobody has any questions. Thank you for that, Sam. And moving forward to the ILOG report, asking for Sam to present that.
So the ILOG report, it's for governors to receive again and to note the detail of the submissions in a set period as stated on the front sheet of the report. The governors are asked to receive the report. So for anybody that doesn't know what an ILOG is our mechanism, our governor mechanism for receiving in issues, ideas, innovations, anything beginning with an I, that our membership might feel that they want to tell our governors, and then for our governors to then feed that back to the board. So we have a list of those that are here. One of them is Amber still, although since the papers went out, I have got an update that formal process has now been closed. So there has been more discussion in relation to that, and the formal discussions have been happily resolved. So that one can now go green in terms of the action. But in terms of this report, it's there for you to see what came in, what the outcomes were in terms of what we did with it, and what its progress is, whether it's closed or it still remains open due to further discussion. So I'm happy to take any questions in relation to that, but I hope that gives a bit more background to those governors who aren't quite sure what an ILOG may or may not be.
Any comments or questions from anybody on the call? And I take that as read that we've got nobody requiring to ask a question. Sorry, my voice is gradually going. Can I invite now, under activity planning, item 6.1, Karen Scott to talk through the Governor's agenda for the Council of Governors 25th of July.
Thank you, Bex. Karen Scott, Trust Secretary. So this is the draft agenda of the next Council of Governors meeting agenda. As you say, Bex is being held on the 25th of July. Everything that's currently listed on the Council of Governors forward agenda throughout the year has been picked up on that. Just one or two things to just highlight specifically. It is an annual process, but you'll notice at the very front end of the agenda is the Trust Chair's annual appraisal. And I can let the meeting know that that is actually taking place today, being held with the Senior Independent Non-Exec Director and Acting Lead Governor, and that the report from that and the outcome will be reported to this next formal meeting. Dependent on whether or not the Trust's annual report and accounts has been laid before Parliament, by the time of the next meeting, we will potentially receive the external auditor's report on both. The annual report and accounts was submitted to the parliamentary clerk in very good time, and I did receive confirmation that it was anticipated that with a fair wind it may well be laid prior to summer recess. Very conscious of the change in government and that things are, you know, slightly little bit more less streamlined as they might be ordinarily, but nonetheless they do have to get through their business, so we'll just have to wait and see. We obviously, and just for the benefit of anybody that might be observing the meeting, that is because we cannot publicly publish our annual report and accounts until such time that it has been laid before Parliament. Other than that, I haven't got anything else specifically to note, Bex, but happy to take any questions or comments from anyone in the meeting. Thank you.
Thank you. I had a question myself, looking through the agenda. It says the chairman's appraisal, item 1.1, which you just mentioned, but it also says it's at 4.2.
Yeah, no, sorry, Bex, it's an error. I had omitted to acknowledge that we always put it at the front end of the agenda so that we can actually start the meeting without the Trust Chair in the meeting, and it's much neater if the council receive that report and then we invite Kevin as chair to come in and chair the meeting rather than him have to keep dipping out at the back end. So that 4.2 will actually need to come off the agenda. It is an error. Thanks, Bex, for pointing
Thank you
it
for
out.
that. Thank you for that. Any further questions for the agenda? Reminding people that this meeting is being held face to face, which will be very nice to get back around the table and see a full council of governors meeting together. So yes.
Thanks for pointing that out, Bex. Can I just also add that we will be providing refreshments, so anybody that is coming, we will be ensuring that they will be have sufficient food and drink on the evening. So yeah, it'd be really great to see as many people as we can on the evening. Thank you.
Absolutely. Thank you for that, Karen. Moving on to item 6.2, the Better Together membership magazine. Inviting Jo Walker to speak.
Thank you, Bex. Just as a reminder, I'm Jo Walker, Head of Communications and Participation. So this is a slightly different paper to what you would normally receive from us, because normally this would be just what's coming out in the next edition and the conversation around this. But this was kind of floated at the last meeting, but I was asked to provide, unfortunately I couldn't attend, so I was asked to provide a more in-depth paper this time in terms of some changes we're suggesting making around the actual publication of the Better Together magazine. So Better Together magazine, for I'm sure most of you know, but just to reiterate, is the magazine that goes out to all of our anyone that's signed up as a member. It has historically been quarterly, and then a few years ago and was all 4 printed issues way back when I started 15 years ago. And then it was as email and internet access increased, we went down to 2 print issues and 2 virtual issues, and then a few years ago, because of the kind of the turnaround time in terms of content, we did drop one of the virtual ones and went to 2 print just 3 times a year. But again, as internet access is increasing, and also as a trust and as a society, we're trying to be more environmentally sustainable, trying to make best use of our resources in terms of finances. There's been some conversations internally around actually whether we benchmark elsewhere in terms of other trusts and what they're doing around these types of publications. And there's a suggestion here that actually the print issue is not necessarily adding value in terms of we get a lot of undeliverable newsletters sent back to us. We get quite a high number of magazines that are left to be out of date in our reception areas, etc. So we're proposing taking this down to one main print issue a year, either sticking at the 16 pages it currently is or increasing slightly to make a bit more of a bumper issue. And that is the one that will advertise the annual public meeting each year to make sure that we cover off our duties around that. But actually increasing back to quarterly issues, but the rest of our issues being electronic, and doing a particular push in this next edition with a covering letter, rather than it being in the magazine itself, a covering letter to explain the changes to our members, seek their email addresses if they haven't given them to us yet, and just explaining about the changes that we're proposing. It's useful context to understand that when we became a foundation trust, email and internet use was still relatively low in our community. So at that point in time, our membership application form didn't actually collect email addresses. So a lot of that's been the case now for a number of years, and most people do provide email addresses now that they are asked. So this is just about collecting those that have probably been members for a long time who weren't initially asked. It doesn't mean that they didn't have an email address, it's just that we didn't collect them at that time. I'll take the rest of the paper as read and just open up to questions.
Yeah, I've got a question from Dan Fleshbourne. Would you like to ask your question, Dan?
Thank you, Chair. Dan Fleshbourne, Adult Community Governor. So thank you, Joe, for the report and putting lots of information in there. I just wanted to go over the digital first strategy, if you like, due to the demographics in Lincolnshire and the possibility that older people may not necessarily want or be able to access digital. Some of the diverse groups that where English isn't the first language, or again, maybe travelling, maybe not have access to internet as regularly as maybe suggested in the report. And then finally, so that's two questions. So then the third is if you're aware of Atrium, the sort of the digital displays that are around the county in the community centres, and whether actually the Better Together magazine could be put on there, so it's really open to people who don't have access to a computer themselves and don't actually have that internet access either, so they could go to the local community centre or library and still be able to access it that way.
Thanks, Dan. So just to pick up in terms of the digital, the sort of the generational people that may not want to. We obviously, you'll see in the paper there's some statistics in terms of access to digital, and that has massively grown, and that's some national statistics that I've managed to find, and we know that that has nationally grown. And whilst there are parts of Lincolnshire that don't have high-speed broadband, most places now can access on a smartphone, etc. And our electronic newsletter does rationalise for on smartphones. But you make a good point in terms of some generations not necessarily wanting to, although what we have found, and Jackie's on the call, so she might back me up with this, what we found with the digital memory service assessments, that has actually had quite a big uptake, and in a generation that historically most people think don't like digital access. So we actually know that that has had quite a big uptake. So I think there's some myths around that, although taken on board, there will be some people that don't want to, and that could be something that we could maybe look at on a case-by-case basis, that people could get in touch with us and we could print off the electronic version for a small number. But I'd have to have a conversation with Karen in terms of what the numbers would that and how practical that would be. Sam and Karen, how practical that would be. But we could do that for those that really strongly want to continue to receive updates and but receive the digital version because they don't have access to the internet. So that could be something we consider. And Atrium is a really good point. It's not something I've actually thought about, but actually really good point. Because what we know from those that English isn't the first language, obviously our newsletter is in English and it's not necessarily accessible for all of people's different needs. And we know that our virtual one, by having it on the website, we have all of those accessibility tools that can change language, do large print. We are moving towards the read aloud technology on our website as well for people that don't have screen readers. So actually by having it digitally, it opens up the accessibility aspect of it as well. But the Atrium, for those that don't necessarily have home access, is a really good point, and I will pick that up. Thank you.
Thank you, Jo.
Thank you, Jo. I've got a comment from Pete Burnett. Unfortunately, he's had to leave, but he wants to put forward that he's supportive of the approach that you've put forward, Jo. So thank you for that. And just a comment from myself, is it possible to actually, on the Better Together that is being sent out via email, that it could be formatted maybe into black and white for print costs if people need to print it off for their own requirements, so that you know, it makes life easier for them.
We can certainly have a look at how that would work in terms of printability in black and white, definitely.
Yeah, thank you very much. Do we have any further comments or questions for Jo? I take that as a no. Thank you very much, Jo, for your participation. And on to our final item on the agenda, item 7. I've not been made aware of any other business. Sam, have we had anything, any other business wise that you're aware of?
There's nothing that I'm aware of in terms of any other business. There is a few C&Qs in the chat. I think Karen wants to come in with a question.
Yeah, I'm on that. Thank you very much. Karen, you have a question.
Thanks, Bex. Yeah, just if I could go back to the last item that Jo presented, can I just formally ask for the committee to record that it actually approves the proposal, because there was a request that actually it was considered and approved. So can I just get a show of yeses or whatever in the chat for that? Thank you. Thanks, that seems quite overwhelming. Oh, no, Dan's not.
Got one no.
Okay, but I think given the number of yeses, okay, thank you.
Okay. Carol has a comment to make. Carol Hagan.
Yes. Sorry, Bex, Carol Hagan, Public Governor. I did email Sam, but it was very late last night and Sam might not have picked it up as any other business. I'm presuming that the council has written to Debbie to thank her for her contributions as lead governor. Anybody?
Yeah, sorry, I was just waiting for Bex to invite me in. Sorry, Carol.
Oh, sorry.
Karen, it's okay. Karen Scott, Secretary. Yeah, I can confirm that a letter did go from Kevin on behalf of everybody, board and council, to extend thanks for her contribution and service in that role, Carol. So yes, it has been done formally, and also to Debbie via the email that went out to governors more informally. So thank you for raising that.
Great, thank you.
And I have passed my thanks and thanks on behalf of the council via a telephone conversation that we've had. So she's been thanked in a variety of ways and remains a governor for the foreseeable future until our elections are complete. Hoping that she's nominated herself to remain. Any other business? No. Then thank you very much for giving your time. it looks like I can give you a little bit more time back in your day, and we shall see each other in a couple of weeks' time at the Council of Governors meeting, if not before. Thank you.
Thanks, Bex. Thanks, everyone.